Giving shape to ideas. Conica Minolta.
Now we will start to evaluate the rotator cuff tendons, starting out with the subscapularis tendon, evaluating the point of insertion on the lesser tuberosity. Having the patient externally rotate their arm very slowly. On external rotation, you can appreciate the tendon fibers as they attach to the lesser tuberosity, the footprint. Scanning slowly medial, you'll appreciate the humeral head and the articular surface, the hypoechoic articular surface. Scanning medial, rocking your probe, you'll appreciate the musculotendinous junction of the subscapularis tendon and long axis, and this would be considered the mid-segment. You would have to scan inferior slowly and tilt your probe superior to appreciate the inferior border of the subscapularis tendon. Scanning back to the midline and then scan superior and tilt your probe slightly inferior to appreciate the superior border of the subscapularis tendon and long axis. This also allows you to appreciate the articular surface of the humeral head. Scanning slightly more medial and maybe tilting the probe slowly towards the patient's head medially so that you can identify the coracoid. This is the coracoid process. This is a good location for you to do an internal rotation. Internally rotate the arm will allow you to appreciate the movement of the subscapularis tendon. Also checking to see if there is any subluxation of the biceps tendon or popping. Looking for fluid in the subacromial subdeltoid bursa. Scanning inferior will allow you to look for fluid in the subcoracoid bursa. Now, here we can set ourselves up for a short axis evaluation of the subscap by taking the probe, the lateral side of the probe, and tilting towards the patient's head. Now we will tilt the probe laterally to evaluate the musculotendinous junction of the subscapularis tendon in the short axis plane. We also may need to scan lateral and rock the probe or toe heel the probe to identify the superior border. Rock the probe, heel toe the probe to identify the inferior border in a short axis plane. Coming back to midline, check your tilt as well. Medial lateral tilt will allow you to see the mid segment, and slowly bring the arm in an internal rotation to bring the footprint into a profile view, and this is the short axis view of the subscapularis at the point of insertion. Point of insertion, subscapularis.